Hi everyone, this is Women Empowerment and Healthcare Organization, and we're here today hosting a shadowing session for optometry. As we go through the session, if you have any question, please drop them in the chat box. There will be a small quiz. Hi everyone, this is Women Empowerment and Healthcare. Hi everyone, this is Women Empowerment and There will be a small quiz at the end to record your attendance and obtain your hours. We have with us Dr. Kriti, so may we please ask her to introduce herself and begin the session whenever you're ready, Dr. Kriti.
Awesome, thank you. Hi, everyone. My name is Dr. Kriti Bhagat, and I am currently practicing in Providence, Rhode Island. I'm an optometrist, and I'm going to take you through what it feels like to be an optometrist and the journey to become one. So we'll kind of just start off. I want to talk to you a little bit about what I do. So currently, I am an optometrist that works at two different private practices in Rhode Island. I also do a few other things. I'm an adjunct professor. I used to be a full-time professor at one of the optometry schools in Philadelphia. And now, since I moved to Rhode Island, I am an adjunct. So I get to still teach to students, but I get to do it in a little bit of a more limited role, but I still get to teach. I'm also a consultant for a couple of pharmaceutical companies and for industry leaders. So I kind of get to lecture, travel a little bit for that. And then I volunteer with different organizations in optometry where we can advocate for optometry in general, and also for getting the word out to others about what optometry is. And then on the side, I absolutely love to read. So I am something what you would call a bookstagrammer. So I, on Instagram, like to read books and review them. And so that's a little snippet of what I do. I have some pictures here of me in optometric roles, but I'm going to talk a little bit more about them and kind of tell you about my path. So when it comes to being an optometrist, I unfortunately don't have a really wonderful story of saying that I got glasses when I was a kid or anything like that. How I found out what an optometrist is by shadowing an optometrist in undergrad. So in undergrad, I decided that I definitely wanted to be in the healthcare field. And so I went to UMass Amherst, and that is where I decided to be a part of the pre-medical society and kind of look through different healthcare professions. Here, I shadowed a dentist, a podiatrist, and then one day I was at the healthcare facility, which is our health services on campus, and I actually went to the optometrist and asked if I could shadow. He was actually an expert in contact lenses and red eye and had lectured internationally. So I was already in awe when I went to his office. And then I was able to just shadow through and see kind of him examining different patients, which were students, faculty members. And it was really neat to see the connection that he had with a lot of his patients. I really ended up loving what he was doing. And the other part was it was clean. It was very clean in the office. There were no bodily fluids that were coming out, right? So when it comes to healthcare professions, I thought this was really neat. So I kind of looked into it a little bit more. From there, I'll kind of talk about my journey. I graduated from UMass Amherst in 3 years, and I had a year before I applied to optometry school. I took that year and I took it as a chance to work as an ophthalmic tech. So if you're thinking about any healthcare professions, if you have some extra time or some summer, I would say a great way to get to know if you really like that profession is to be a part of it. So I actually ended up being an ophthalmic tech for a whole year, and I learned a lot of clinical skills that I would end up learning a little bit more about in my first year of optometry school. And that was a great chance for me to know, wow, I like this part of the profession, or I like this specialty, right? So I was able to kind of do that. Then after that, I went to the Pennsylvania College of Optometry at Salus University in Philadelphia. From there, I did a year residency in cornea and contact lenses, and I became a full-time professor. I was that for about 5 years and kind of moved on to be more in a private practice setting, and that's when I moved to Rhode Island. So a little bit about my path. I think it really helps to talk about the path and kind of how we've all found the profession. Because if you are in that kind of realm right now where you're thinking, I love healthcare, I want to help others, I want to be a part of the medical profession, where do I go, or which one's my calling, right? I think the best way to really figure it out is to shadow, and you can always start off with that. And so I think these series are great because you've you've had a chance to hear different doctors talk about what their professions are and kind of what their life looks like, right? So today what I'm going to do is I'll talk a little bit about what an optometrist is, how much schooling is involved, right? Because that's something definitely everyone wants to know. And then we'll kind of talk a little bit about residencies and then career routes that you can take. There are so many modes of practicing. It's not just, you go see the eye doctor and, get glasses and contacts. It's not just about that. There's many different ways you can take your career, and you might find that your career might change a lot in between. So we'll talk a little bit about that, and then we'll talk about what a typical work week looks like for me. And then I have this really cool case that I'd like to talk to you about. So, and then at the end, we'll end with some questions. So what is an optometrist, right? An optometrist is an independent primary healthcare professional for the eye. So optometrists examine, diagnose, treat, and manage disease. So you think optometrist, just my eye doctor, right? That gives glasses and contacts? Absolutely no. We do so much more than just that. And so we can really look at injuries. We can manage traumatic brain injuries. We can look and diagnose tumors sometimes early on. We can actually tell patients about their high blood pressure, diabetes, a lot of things like that. And so we're really kind of a full healthcare professional that can help in the management of a patient's overall health also, not just the eye. As an optometrist, depending on which state you practice in, you have different rights. You can prescribe medications, you can do rehab work, vision therapy, glasses, specialty contact lenses, which is something I do a lot of. And even in some states, if our scope of practice allows it, we can actually do lasers and minor procedures. So I get asked this question all the time from a lot of patients. What's the difference between an optometrist and an ophthalmologist? And I would say back in the day, it was a very easy, clear-cut answer. Optometrists did not do surgery. But because of the scopes of practice in each states have changed, we can actually do some minor procedures in some states. So it's very state dependent. Now, that kind of goes back to you. If that's something that you were thinking, oh, I'd like to do procedures, that's the route I want to take, you can actually do that in some states. Optometrists practice in many different various settings. So you can do private practice, you can do academia, you can work at a VA hospital. We'll talk a little bit more about all the different settings that you can practice in, but you can go from private practice to hospitals, research, industry, and kind of choose which route you want to take. And if you're someone like me that can't really choose, you can dabble in little different forms all around. So you don't have to really just pick one route. And one of the biggest questions that we get asked is, how much do you make? Well, the average income is $140,000 a year. And that, I will say, is average. So it can really change depending on what type of setting you're in. It could be a little bit lower when you're starting off in the beginning, and then you can grow to even more than that. Let's talk about women in optometry. I feel like women in optometry are dominating. This was a profession that about 30 years ago, if you looked at the optometrists practicing, it was about 80% male dominated field. And now if you look at the numbers, even between just 2009 to 2022, in 2009, 29% of optometrists identified themselves as women, and about 64% of optometry students were women. So in 2009, we were already starting to see a very big change in the trend. We were starting to see that more and more optometry students were women. And you can see that translate even into our numbers now, where in the profession, 43% of optometrists identify themselves as women today in the field. And then you have about 68% of optometry students that are women. So we're doing a lot. Women are really changing this profession, and it has changed a lot because you'll see that in many different organizations. So you'll start seeing that women are being more and more part of boards, such as about 50% of the American Optometric Association Board of Trustees right now identify themselves as women. That's a big deal because that wasn't like that years ago. And even when I was in school, you saw like a lot of board members were male. So we're seeing that it's becoming more and more of an equal field. There are some things that are still a little bit more challenging. There is about a 6% wage gap between male and females. So something definitely working on, but I think as the profession changes and we're getting more and more equivalent to our male counterparts, I think that's where we'll kind of decrease that wage gap. So when we kind of look to becoming an optometrist, right? What's the timeline here? Well, I outlined a very traditional kind of course. So here you can see you finish middle school, high school, and then you go to graduate school. So there's 4 years of undergrad college to obtain a bachelor degree. Now, it doesn't always have to be 4 years. Like I said earlier, I graduated in 3 years, but that gave me an opportunity to work as a tech for a year. So when it comes to undergraduate college, one of the biggest things that they look for is that you're taking courses that are really kind of more in the science field. So you definitely want to take biology, chemistry, organic chemistry, microbiology, biochem. Those are all some classes that you want to take. And a lot of these classes come with laboratory experience also. So every school that you're applying to, just double check and look at their requirements. Because I remember when I was applying to Pennsylvania College of Optometry, one of their requirements was biochem with lab. And I didn't have that because I only had biochem. So it was something that later on I had to go back and make sure that I took a class with the lab. So depending on which school you're going to, just make sure you look at their requirements, but you'll see that it's very science heavy. After that, you go through 4 years of optometry school, and we'll talk a little bit about all the schools that are out there. But after optometry school, you do have a choice of doing either a 1 or 2 year optional residency. So for optometrists, it is optional to do a residency. And you'll see how doing a residency gives you a chance to kind of specialize a little bit more or really hone in on skills that you're looking forward to. So we'll talk about what residency entails. Now, there are 7-year bachelor/OD program combined, and there's also a 3-year accelerated optometry program. So, like I said, the outline that I have is a very traditional outline for becoming an optometrist, but there are other programs that are out there if that timeline doesn't suit you. There are 23 accredited optometry schools, 22 are continental, and 1 in Puerto Rico. Now, it all depends on what you're looking for when you're looking at optometry schools. I always like to think of it as it's not the optometry school that's interviewing you. You're interviewing the optometry schools also. So you want to take a look at, let's say, size of the class. If you are someone that likes to be in smaller classrooms, get more kind of a one-on-one ratio, then you want to look at some of the smaller schools versus schools that have a bigger class size. Location, I'm sure, matters a lot. As you can see on this map, there are locations all around kind of the US. Program matters. Some programs are more clinic heavy from day one, or they're a little bit more separated where you go through the schooling part a little bit more heavier on the beginning of the program, and then it transitions later on into more clinical and patient care program. And then you want to look at the merits of the schools also. So those are some things that you want to look at. Finally, I would say cost. Definitely with student loans and someone who's still paying student loans, I would say look at the cost. There are some areas like metropolitan areas, the schools will be a little bit more expensive versus going into a more rural setting. So let's say you decided that you want to apply to optometry school. What are the steps that you're looking into? Well, if you're an undergrad, then you want to start thinking about applications. Applications generally open around this time of the year. So end of June, early July is when applications are open. They're all done through Optomcast. So Optomcast is just one portal, and you can actually apply to all the different schools through there. So you don't have to upload your letter of recommendation 15 different times. You can actually just send it out through there. You want to check with every school what the requirements are. So some schools require 2 letter of recommendations. Others may require 3. You, once again, want to look at the courses, which courses are requirements for the schools versus recommendations. You have to upload your transcripts from undergrad. I think high school transcripts are also needed in some schools, and then also a personal essay. The next thing you need is your OAT score. So the OAT score is your is a standardized test. It's the optometry admission test, and it's an English-based standardized test that has a few different topics. So they test you on natural sciences, they test you on physics, reading comprehension, and quantitative reasoning. The test is about 5 hours. So it's actually, if you're thinking about applying, the summer after your sophomore year or the summer after your junior year are the years where you want to start thinking about this. So you do need some time to study for it. Just like any other test where you've heard of MCAT or dental admission test, all of those, you do have some time to study for it. They do have programs that can help you. I believe Kaplan is the program that I use for it then, just to help you study, give you some structure. But I studied for about a month before I took the test, and I took the test twice just to see my scores. And then you submit the scores on the portal, and that's kind of like when you take your SAT scores, right? So it's a little bit like that. Some schools also do accept MCAT, DAT, or GRE scores. So you want to look into that if you've already taken that. And then once the school receives everything it needs for their application, they will ask you for an interview. So you go to the school. I believe during COVID, many of them were virtually done, but it's really nice to be able to go back to the school and kind of, I think those doors are open now, but you can interview at the university or school that you're applying to. I think that's a big deal to actually go to the university, to see the campus, see what facilities they have, and see if it's a match for you. It's the same way as when you were picking undergrad schools. That's very similar to that process. So now you get into optometry school. What's the next step, right? So optometry school itself traditionally is a 4-year program. There are 3-year programs that are accelerated. So if that's something that, you're really like, I mean, graduating in 3 years sounds really good, but I will say it's accelerated. So it's the same amount of coursework, but just in a smaller amount of time. With a 4-year program, year 1 is very didactic. So that's where you're going to be studying a lot more. You're going to do basically a refresher on the sciences. This is where we're taking our optics classes. So a lot of physics. If physics is not something you like, which I will say, physics was not something I loved. It was something that I really had to study and put my mind to and really kind of spend time kind of reviewing a lot of. Most schools, year 1, they do start clinical skills. So you will be trained on doing some entrance exams on patients and learning different smaller skills, introductory skills. But the focus is really much more didactic training. Year 2 is a little bit more of that didactic or schoolwork training. You have other classes. Now you're getting into a little bit more of your ocular disease classes, kind of more honing in onto the eye itself. And then here you're doing definitely a lot more clinical skills, harder clinical skills tests that you have to pass. And then in some universities, they actually allow patient interactions. So you're in clinic, you're either shadowing or you're actually doing some of the tests for the 3rd or 4th year students. 3rd year, you're starting to your time is more spent in clinic. So you're doing more clinical work, you're with more patients, doing a full exam from beginning to end. And then by 4th year, you are ready to go off on your rotations. Each school has a different requirement for their rotations. Some schools have requirements that you have to take a contact lens rotation, you have to do a VA or a hospital rotation. Some have requirements where you have to do a private practice rotation. So you just got to go through which rotations that they have. And a lot of these rotations are sites where doctors have been students at that university. So there are alumni. And so they are very familiar with their program and they help you with the type of patients that they're seeing. I will say for my rotations, I really enjoyed them. I picked a rotation in New Hampshire, which was a private practice. I did a VA in Rhode Island rotation. And then I was at the school where I did a contact lens rotation. These were all rotations that were in very, very different settings. So I was able to really experience what it felt like to be in a traditional private practice setting, where I was able to meet community patients, really get to know them, talk to them about different classes that they might benefit from. And then when you go to a school setting where you're doing specialty contact lenses, completely different vibe. right? So it was really nice to get 3 months at different rotations because it just opens your eyes to different opportunities that you may have or what you might excel in. Um, I'm trying to think. For me, I really enjoyed private practice because it was my way of getting to know patients, getting to know that they took their grandkids to Disneyland, right? Things like that, versus a very high-paced retail setting. You don't have that much time to do that, and you're seeing different patients all the time. There's not that strong of a connection. So rotations are great and they're really fun because sometimes you can pick to go to different areas. So I know I had friends that picked, Miami, or they had a chance to travel to Washington, D.C. or California from the East Coast. And so people have fun with them. You get to meet a lot of different students from different schools. And so it's really a good time and probably one of the most memorable times from school. Now, during your time at optometry school, there is one big test that you have to take, and it's split into 3 different parts. It's the national boards. So the national boards are in 3 different parts, and they're done throughout your 3rd and 4th year generally. The first part is probably, I would say, the hardest. The first part of the national boards is very, very kind of school-based. So this is a standardized test that you're taking. You study for months before you take it. And it's a little bit of a review of everything you learned in optometry school. So it used to be a 2-day test. I believe now it's a 1-day boards exam. And then the second part is a little bit more clinical based. So there are cases. And so you start off with a patient that presents and you'll be asked a few different questions from there. And that's also written. And then finally, the third part is where you have to go to Charlotte, North Carolina, and you actually performing different clinical skills, and they grade you off of your performance with real patients. You must pass all 3 of these parts for you to be able to practice in most of the states. You will not be able to practice and see patients without your boards, passing your boards. You can graduate from optometry school, you can't see patients legally. So a lot of insurances and many private practice settings or hospitals, first thing they'll ask you is a certificate that says that you pass boards. So we talked about what an optometrist is, right? All the different things that we can do. But what is optometry, right? Optometry is the study of the eye. So I pull up this, and I'm sure you know about what the eye looks like, but there are many, many different parts to this one organ that we have. There's the front part of the eye, and then there's the back part, and that's probably the easiest way to split this. I will say that I have had most of my training on the front part, so the anterior segment is what we call it, and that's the part that gets me really excited, and that's the type of patients that I generally see. There are many different facets in optometry. So you can do primary care optometry, which I do when I'm in private practice. I don't know what's going to come in. It could be someone, complaining they can't see the sign, or it could be someone who lost their vision within an hour and it's not back. So it really does change on what you see in primary care setting. We do go through optics and refractions. So we learn a lot about physics because we are dealing with glasses and images and inverted images versus straight ones, right? So we do a lot of that when we're going through school and learning. Then we do contact lenses. You can specialize in pediatrics, and then you can specialize in anterior segment or posterior segment, which is the front of the eye or the back of the eye. We can also manage low vision patients. We see patients in neurooptometry, manage patients with traumatic brain injuries, and in vision rehab. And so there's many different things that you can do in optometry relating to the eye. And now finally, you've graduated school. So what's the next step? Well, you can go into one of the modes of careers that we'll talk about. So modes of practice, you can go straight into that. So if you have a private practice you want to work at, or a retail setting, there's something that you already have lined up, you can definitely go there straight right after optometry school, or you can choose to do a residency. I have a picture up of my residency class. Absolutely loved my residency class, and I did it at the same university that I went to school. They have 1 or 2 year residencies, and you can choose your specialty. So very similar to medical school, you apply for the residency, different residencies, and then you interview, and it's a match system. They have specialties in primary care, community health, geriatric, cornea and contact lens, ocular disease, refractive and ocular surgery, anterior segment, glaucoma, retina, neurooptometry, vision rehab, vision therapy, low vision, and brain injury. There are different combinations of that. There are some that are combined and then some that are different. I did mines in cornea and contact lens. That is definitely a passion of mine. So the cornea is basically like the windshield of the eye, and that's the front part. So that's what I focused on. And I did a lot with contact lenses. And we'll talk a little bit about what type of patients I see because of the residency that I did. Now, residencies aren't required in general for you to practice and be out in the real world, but it is a requirement for working at a VA hospital or working in an academic setting. So I did my residency knowing the fact that I wanted to teach. I was really big on that. I wanted to stay in academia and be a professor. And so that's one of my biggest reasons for why I did a residency. And then the second reason was I wanted to specialize. So let's say you choose pediatrics and you're really good with kids and that's what you want to specialize in. Your 1-year residency gives you a chance to really see a majority of pediatric patients versus if you go into a private practice setting, you might see kids here and there. You might see adults. You're going to see something different every day versus in a residency, you're really seeing a majority of the patients in that specialty. You also work with faculty members and attendings that are experts in that field, and you go through grand rounds, you go through different lectures. So you're also learning. So it's a little bit more like school, but specialized. And I will say it's really neat being a resident. And my experience was, all the doctors that taught me, I was working with them now and learning from them from a different perspective than just as a student. So I was definitely something that I will say probably one of my best decisions I've made was to do a residency. But for some people, it's not. That's something they choose to do, and that's also fair. So if you choose not to do a residency or you've completed your residency, now you can kind of start thinking about how do you want to practice? What different ways do you have of practicing in the real world, right? So you can practice in a private practice setting. So a private practice setting is where you're working and seeing regular patients that are coming in for their yearly exams or for the first time eye exam. They're seeing blurry. They want to come in for glasses or contacts. It's a little bit about private practice. You can definitely specialize to a certain field. So I do specialty lenses. And so most patients that are coming in, they come in to see me for that reason. But when I first started off, I'd see anybody and everyone, right? The next mode of practice is partnership or group practice. So you're working either with other optometrists or you're working with an ophthalmologist who's doing surgery. So you're kind of working together in a practice. Retail or optical settings is another great option. You may have heard of, Lens Crafters, Pearl Vision, My Eye Doctor. Those are a little bit more on the retail side. They also do medical practice in those practices, but they have a very robust optical. So you do get training on how to sell glasses or measuring for glasses, right? Different types of filters and glasses that you can do. So you're a little bit more on the retail side of things. Like I said earlier, you have the optometric and ophthalmologic professional setting, which is a combination of both professions working together. You can work in a military or public health setting, a VA setting, and then academic or research. So that's really neat. And that's something I did. And you get to work with other students, teach. You're still seeing patients if that's what you choose to do. If you're just 100% research, you're working with patients more in a research setting, and you're working with different either industry leaders or even with the government. So that's really cool because if research is something you're interested in, a lot of academic institutions do that, and even some private practices can do that. Corporate industry is a little bit of a different field. That is where you can actually work with one of the companies that is geared towards eyes or ocular health, and you can have a role in professional affairs. You can be a medical science liaison. So these are people that are not seeing patients as much, but what they're doing is they're managing maybe speakers for that company. And so there's a lot of different executive roles that are available in that setting also. And then finally, you can be a consultant. So that means that you can either full-time work for one of these industry partners and speak and represent that. So if I were to speak for the glasses company, I would be a consultant for them and I would tell you a little bit about the material. I would either talk to other optometrists or to just general public about that. So those are great roles too. And those are all the different settings and modes of practice. I'm sure there are others, but I think this is the bulk of all the different ways you can take your career. The one thing I would like to say is a balance. The wonderful part about optometry is that you can do as you please. If the setting of being able to go to work in the morning and being able to get off at 4 or 5 o'clock, coming home to a family or coming home to travel, whatever you want to do, you can balance that. So a lot of times I have some friends who work part-time and they can do that part-time work and work maybe 1 or 2 days in clinic. Or you can be someone like me that does 5 different settings because I love all of them. So for me, I work in a private practice setting. I have worked in retail to fill in. It's fun. It's a different pace. Then I work in academia as an adjunct professor. So I still teach with students and interact with the next generation of optometrists coming in. And then I also work as a consultant. So you can balance it however way you want to. I get asked the question all the time, like, do we have to work all the time? If you're working either in private practice or if you're working in a hospital, you don't have to work all the time. You can really kind of find a right balance of it. And there are many opportunities. When I first started, I was full academia, 100%. Opportunities came for me as a consultant, opportunities came in the private practice world. And so I was kind of able to balance and transition into that. And then a lot with optometry, there's a lot of chances for advocacy. So that means you can advocate for your patients. You can work with insurance companies. You can work with just the profession in general to educate and get people to have more eye exams. So you can really work on that realm also. And also financial freedom. So one of the good parts about being an optometrist is that eventually, when you have your student loans paid off, it is financially freeing. You make good money being an optometrist. And so it's a great career choice from that perspective. So I'll transition into what a typical work week looks like. This is very funny for me to say because I want to say that my work weeks are not typically the same every week. And I love that. That's the type of work, that life that I've created. So once again, I'm in a clinical setting, so I am seeing patients. I'm an adjunct professor, which means that I am still grading papers or doing lectures either in person or in Zoom. And that's a great break from just seeing patients all the time. I consult, which means I speak for different contact lens companies and educate other optometrists or even students about different contact lenses. I work for, I'm part of a board for our state association. So I am fighting for rights or being able to practice, scope of practice, making sure that patients know about optometry in general and eye health. So I am a part of our board. And then I volunteer a lot of my time with different organizations throughout optometry. Just making sure that, you know, we're out there and we're getting the word out, educating people. And so I volunteer. And then if all of that wasn't enough, recently I am starting a cold start practice. So while I work in a clinical setting, I am starting my own optometric office, and that's going to focus a little bit more about the type of patients that I'll talk about in a moment. And once again, like I said, it's never the same for me. So I have the schedule up, which looks like a typical work week for me, but it's never the same. I love traveling. I love reading. So I get to incorporate that in my life also. And that's what I love about optometry, is that I can really create a balance that I like. So on Mondays, I work from home generally, where I answer emails or I'm going through kind of looking at the volunteer work. I'm grading papers or I'm lecturing to students, and I schedule that in on Mondays. Tuesday, Wednesday, Thursday, and Friday, I work in patient care. So this is when I'm seeing patients. And then on weekends, sometimes I do travel for consulting work or for meetings or lecturing for what we call continuing education and making sure that others kind of know about the cool patients that I'm seeing, right? So I stay pretty busy. The type of patients that I'm seeing, once again, my specialty is specialty contact lenses. And so I kind of the coolest patients I probably see are part of theater. So I help design contact lenses for different movies and theater settings, and I can design them with patients, or they get to choose different type of contacts, and kind of we computer generate them and order them from labs. I do have patients that sometimes experience they're very, very intolerant of light, so they have problems with glare, and so we use tinted contacts. I do a lot of those. These are just some examples of different type of patients I see. So the first one, kind of at top left, those are transitioning contact lenses where you can help with kind of when they go from inside to outside, they transition to darker shades. And so I fit patients like that. I also work in a refractive surgery center. So patients who are interested in LASIK or getting rid of their glasses and contacts, I actually work in that type of setting also. Then the next picture on the top right, that's a picture of a cornea, and it's kind of designed by taking these measurements. I see a lot of patients with different corneal diseases, so we help design contact lenses very specific to that type of patient population. At the same time, because I am seeing a lot of patients that have problems more so in the front of their eye, I see patients who have corneal scars. So bottom left, that's a patient who was wearing contact lenses and developed an ulcer and ended up with a scar. And now we're managing that. Then the next picture with the little red contact lens there, that is a patient that's wearing a red tinted lens to help them be able to tolerate light a little bit better. And then bottom right, picture is a picture of a hard contact lens that a patient's being fit with. And this is what a typical great fit looks like. So a lot of contact lens stuff, and that's typically the patients I'm seeing. So I have a quick case here for you of a patient that I had seen. This was a 9-year-old African-American male. One of my dearest and first custom contact lens patient that I saw. He had something called bilateral iris colobomas. So when we look at our eyes and you look at the black spot right in the middle, that is called the pupil. And the pupil is actually a hole. So it's just a straight hole through like a black hole. And it's supposed to be round. And the reason why it helps that it's round, it works with optics and allowing light to pass through so that we're seeing an image through that round circle. Now, for him, you can see here, he did not have a round circle. He had kind of like this keyhole appearance, what we call it. And you can see at the bottom here, it's kind of stretched out. And so because this is not a round pupil, this area right here is doing, it's allowing a lot more light into their eye, into that patient's eye. And they're experiencing more glare, or when they're looking at letters, looking at screens, they kind of see a shadowing effect. So this 9-year-old patient of mine was actually trying out to be a Disney child actor. And so he was telling me that when he's in a setting with bright light shining on him and he was trying to read the prompt, he was having trouble because he was very sensitive to light. And also that he was having trouble with reading the actual letters because they were kind of blurry, kind of look like almost two images on top of each other. So what we did for him, and you can see here, this is his original picture with like that keyhole, not round appearance. We designed a contact lens to kind of black out the bottom part to create a nice round pupil. And that would help him because now he's not getting that extra light going in through the bottom. And this helped him so that he could tolerate the light and read the prompt screen easily. It's kind of neat. I was working with him. I asked him, I'm like, do you want purple eyes? Do you want yellow flecks? Do you want green lines on there? He was a really simple guy. He just wanted brown color to stop the light from coming in. And so we designed just that type of contact lens. Last thing I want to say is have fun. There's so many different ways you can balance your life in having a career in optometry. Like I said, I really love to read. I like to travel, photography, things like that. Just have a good time. And I'm able to do that with being an optometrist. So it's just about finding that balance. And with optometry, I feel like I found the right balance. Well, that's all I have for you about kind of a day in the life with an optometrist. Does anyone have any questions?
We do have a lot of questions in the chat box. So the first question is, what are some tips to handle the workload in a professional school?
That's a great question because, oh, wow. I struggled with that when I was in school. Just making sure that you have a great support system was the most important for me. I had great friends and family that were always checking in on me, maybe helping me. My family was luckily close by that they could come by and drop off food so I wouldn't have to think about small things like that. So my support system was probably the most helpful in handling kind of the workload in school.
That's amazing. The next question we have is, what information or advice do you wish you had known when you were an undergrad?
That's a really good question. I go back and I think I wish I'd known about optometry earlier in undergrad. I found out a little bit later. And so if I had known a little bit earlier, maybe first year or even growing up, if I had that want to be an optometrist, I don't know if I would have taken that 1 year in between. I think I would have gone straight through.
A participant has asked, it can be hard to find places to shadow at. So what are some tips for you to have to approach a doctor and ask them to shadow or volunteer?
Reach out. Reach out to me. Let me know where you are, and I can see if I have a friend in that area. But what I did when I wanted to shadow, and I completely agree with you, I think COVID has even made it harder because we want less people in our offices sometimes. But what I would say is just reach out to different practices, do a Yelp search or a Google search of optometrists in your area, and then just start calling. Call and ask, hi, I'm a student, a prospective student that's looking into optometry, and I was wondering if I could shadow. A lot of people will say no, but what's the worst? They said no, but just reach out to them. But if you meet an optometrist, or like I said, myself, you can email me and I can see if I can help you kind of connect you with someone in your area.
Another question we have here is, how are your clinical experiences?
My clinical experiences in school were interesting. We saw a lot of disease in that area where I was from. So I felt like I was very strong in ocular disease. But when it came to contact lenses, which is what I was really interested in, I didn't see a lot of that until I went to my rotations. When I went to my rotation, I was able to really experience all the different types of optometry a little bit more. I was also able to see what real world setting looked like. So when you're in school going through clinicals, it's very different because it's depending on which school and what area you're in, you're going to see a different type of patient population. While in some private practices, when I went to New Hampshire, I was seeing community members, right? Families. I was seeing the grandparent and then the child. And so it helped me understand that there are different modes of practice. And so some clinicals are going to be harder than others, but they just teach you a lot, like different kind of modes of practicing.
And the last question we have here is, with residency, are you still able to perform regular eye exams?
Absolutely. With residency, it depends on which type of setting you're going for. If you choose a primary care residency, you definitely are doing comprehensive eye exams. I think in most residencies, there's definitely experiences that you have where you're seeing regular kind of yearly eye exams. And if you're not, sometimes during residency, you're not making a lot of money. So you can be like me and work at a retail setting where you can get that experience if you're not getting it in your residency, and you can make a little money on the side.
That was great. So that's it for now. Thank you for everyone for joining us today. There's a link in the chat box to the quiz, so please complete that for us to record your hours. And thank you once again for everyone joining us.